This is basic facial video. And we're actually going to start from the point of arrival at work. So when you get to work, the first thing that you're going to do before you prepare your station is you're going to clean your hands. So you're going to clean before you even start your setup process. So you're going to wet your hands, and then you're going to find your liquid hand soap, and you're going to apply that coin size into your palms, and you're going to wash your palms down to your wrists, and you're going to wash the back of your hands down to your wrists, and you're going to wash your fingers, and you're going to wash the back of your fingers. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your fingertips and your nails, your thumbs, of course. And you're going to wash your wrists. And you're going to make sure that you do that in your interlocking cleanse and all of this for a minimum of 20 to 30 seconds at least. And then you can do your good rinse. Once everything is properly rinsed, you can identify either a clean towel or a disposable paper towel. You're going to turn off the water at the sink with a towel. And then you'll completely dry your hands off. And when your hands are nice and dry, you can discard the disposable paper towels or put the clean towel, which is now dirty, into the closed container until you laundry. And then you finish with your hand sanitizer, which is always 70% ethyl alcohol. And you go ahead and sanitize. Then what you're going to need to do is clean and disinfect your work area and station and set everything up. So we're going to review all of that before you even greet your client. You're going to do some, this will be done before the client gets there, of course, because you would not want her or him to wait around while you set up for the facial. So let's talk about how you prepare the room before your appointment arrives. You are going to disinfect your workstation, your bed, and equipment using a disinfectant wipe following manufacturer's instructions. You will check your equipment to ensure that all devices are in safe working order and plugged into a working receptacle. You're going to gather clean supplies needed for the facial service and store in a clean closed container. And then you'll turn on the hot cabbie and stock with at least 3 clean wet towels. Maybe you may need more than that, so depending on the service and the client's needs, you'll just assess each appointment. You'll fill clean steamer glass with distilled water, and you're going to preheat your steamer. You're going to dispense products needed for the service according to the skin type and client's needs as follows. You will prepare disposable portion cup or tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup or tray. Then the other options, if you don't do it that way, is you can remove the product with a disinfected or clean single-use spatula and discard. If you want to do that, when you're done, you would close the lid to the product and set the portion cup or tray on the tray. And then you're going to drape your facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed, which I've already done that. And I will show you my setup tray as well in a minute. And then you're going to do, horizontally at the head of the bed. You're going to lay a hairnet and a headband or both on top of the first towel. And then along with a roll towel to support the head and neck of the client, save the 3rd towel to lay across the client's décolleté. So we're going to look at the tray, and after we do our client consultation, we'll get her set up. So I'm just going to turn my camera so that you can see my tray. Hopefully you can see it. I'm going to put my trash can back here a little bit. And I've done just that. I've got my disposable portion cups or trays filled up with my product. I have my toner, some water, four squares. I've got cotton rounds. I've got gauze squares. I've got my scoopies to scoop in trash. And I've, just for sake of saving, I've broken mine in half, but I would never do that at a facial service. I've got disposable gloves. I've got a fan brush. All the things are ready to go before my client arrives. So let's go back to the client because we're going to meet her and consult over her facial. So now she's arrived, we welcome her in and we take her to our workstation, and this is what happens there. By the way, when I greeted and met with her, my hands were clean. I'm going to wash them again, but just so you know, I have clean hands after I set up before I greet my client. Always thinking about clean hands. I determine the client's preferences once she's in our work area and assess the client's needs. I'm going to give that visual skin analysis before we proceed, because we need to ensure that there's no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, such as an infection or infestation like lice or scabies, to prevent from safely performing the service. We're going to assess the client's consultation form for any medications and products that have been used within the last 72 hours. We'll consult on any known allergies. We're going to consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care. We'll assess if the client is prone to cold sores or fever blisters. We will assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We're always encouraging SPF. We assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. And if the client is free from any of those contraindications, it's okay for us to proceed with the service, which, for all intents and purposes, we know she is. So we will get started, and before we can start anything, we have to wash our hands, number one. Sorry, I'm freezing. I'm just adjusting the temperature. So let's set her up, and then we'll wash our hands. So we're going to get her to the bed. She is laying down under the sheet, and what we're going to do is we are going to drape her with another towel. She's cozy. We have our towel horizontally, and here's our roll towel that we're going to put underneath her neck for comfort and support. We're going to put on, I have a hairnet today, so that's what we're going to put on today. My things don't stay on very well on these mannequins, but we're going to try. We're always going to use it. But a person with hair, client with hair, much easier to work with. And now she is comfortable, she is cozy, and it's time for you to wash your hands, because you don't do anything without that step. So you're going to wet your hands at the sink. You're going to find your liquid hand soap. You're going to place that coin size amount in your hands, and you're going to rub your palms together down to the wrists. You're going to wash the back of your hands down to your wrists. You are going to wash your fingers and the backs of your fingers. You're going to wash between your fingers. You're going to wash between your fingers and your thumb. You're going to wash your fingertips and nails. You are going to wash your thumbs. You are going to wash your wrists. And you're going to do that interlocking motion, 20 to 30 seconds minimum underneath the water. When you have completed that, you can do your thorough rinse. Once the hands are rinsed, you can either find a clean towel or disposable paper towels. Grab the towel, turn the water off with that hand, completely dry your hands off, and then toss the disposable paper towels into the trash, or put your dirty towel in a closed place until it's laundered. And then you're going to grab your hand sanitizer, which is 70% low alcohol, and you will sanitize your hands before you even touch the client's face. And what we're going to do first is we're going to take off her makeup. So we are going to start with that step. Making sure you get all the makeup off. taking your time. Your client is happy to be here. So we've removed eye makeup and we've removed lipstick. Now we want to do one cleanse before we analyze the skin to get all the rest of the stuff off. So this is the first cleanse. Excellent. So now we're going to remove that cleanse. Giving that attention to detail and care for our sweet little lady. And now it is time to do our skin analysis. So what we're going to do is we're going to bring in a magnifying lamp. You could use a Woods lamp if you had that as well. So we have to protect those eyes before we even do that because we're going to turn a light on. I tried to set it up today so I could use one. And it's at this point that I'm going to analyze her face. And really, honestly, what I'm looking for at this point is some things that we talked about before we even started. I'm looking for hyperpigmentation. I'm looking for blemish, excess sebum, blemishes. I'm looking for fine lines. I'm looking for flakiness, like dehydrated skin. I'm really giving it a proper go. so that when I, move forward with exfoliation, extraction, everything, I am looking for skin texture, like all of the important things. This is where we spend a little bit of time. And when we finished our skin analysis, we of course would move that out of the way and remove the cotton rounds. And what we have to do now is we have to do cleanse number 2 and cleanse number 3. So let's do cleanse number 2. And we need to remove it. Okay. So now it is good old cleanse number 3. Last cleanse here. Getting anything that's remaining that we need to get rid of. If anything is at this point. We've been really doing good thorough cleans. So hopefully we're just really just super duper duper clean at this point. And she's just feeling great. All right, we need to remove cleanse number 3. Okay, cleanser's removed, so we are going to tone. And I'm going to use a spray onto some cotton rounds. You just want to make sure it never touches the tip doesn't touch, but you can also use that spray over the face, like it's what you prefer. And once you have cleansed and toned, you will move forward to the exfoliation step. And what you're going to want to do for your exfoliation step is you're just going to get like a pea size of exfoliant. And obviously we're going to be following manufacturer's instructions on kind and how much, etc., and what to do. But we don't need a lot of exfoliant, so we're going to grab that pea size, and then we're just going to kind of spread it out on the client before we start the massage part. And then we're going to, based on what that recommendation is, we are going to massage for 1 to 2 minutes. Based on what that recommendation is with the exfoliant. And once you're finished with your massaging it in based on what that recommendation is, this is where things change a little bit. And I have to pretend because I don't have the next step. Of exfoliation. I don't have a steamer, so let me just talk to you about what's going to happen. So we have massage that in for 1 to 2 minutes. Of course, we didn't get it in the eyes, nose, and mouth. And then we would locate our steamer. We're going to turn it to that on position, and we're just going to pretend through this section. So we would bring it over to the client. We would turn it to the on position, but it would be facing away from the client. And we're going to let the water heat up and emit an even outflow of mist away from the client first. Pardon me. Once the steamer is emitting a mist, position the steamer 16 inches over the client's face. And then it's going to, we're going to aim it at the chin, and it's for even distribution. And then it's going to function for 3 to 5 minutes, doing all of its steamy that way. Which we just have to pretend like is actually happening, and we're not going to wait here for 3 to 5 minutes because of the video, but just so you know, that's where this is where the steam portion comes into the routine. And once your steam is done, you have to turn it away from your client, and then return it to its previous location for disinfection, turning it off. So we normally would be going to also get a hot towel out of our cabbie after post-exfoliation. I don't have a cabbie, so I'm going to pretend like I have a hot towel. And I have a towel here that's wet. I'm just going to pretend like it's hot and that we got it out of the cabbie. And what you're going to do first is always check that temperature on yourself. Let it cool down. Let's see if it's okay. You don't want it cold, but I mean let it so that you can touch. And then check also at the client's collarbone. Client says it feels great. So I'm going to fold my towel, and then I'm going to take this warm, steamy towel to her face for exfoliation. So I'm going to remove exfoliation. I'm going to keep her nose out, and I'm going to fold that towel nicely so she can breathe. Remove it of all that product. And once you've removed the exfoliating product, this is the time when you get to do extraction. So I'm just drying my hands really good because when you do extractions, you need to have your gloves on. So I'm getting a pair of disposable gloves to put on. And there's 2 methods of extraction that we could use. We could use cotton rounds soaked in astringent in our hands, our fingers. We could also use those wooden stick Q-tips soaked in astringent. I'm going to use cotton rounds because last video I used the wooden sticked Q-tips. With the sticks, you throw them away between every extraction. So 2 sticks per extraction. You're going to use your cotton rounds for all of it and just work your way around. So I'm going to get my cotton rounds soaked in astringent before I go into do any kind of extraction. And I'm just going to use gentle pressure when applying. Pressure to remove. Your extraction process, you do not want to take more than 5 to 7 minutes because it's uncomfortable for the client. So you want to get it over with, and you want her to enjoy her facial, not feel like it's torture. But you do want to get decongestion out of the skin or excess sebum. One more. And that's enough. She doesn't need a lot of extraction. So you will take off your disposable gloves and throw them away. And anything that you use during that process, of course, would be discarded immediately. Those cotton rounds, or if you used those Q-tips, you would be tossing them into the trash. And then we're going to finish this step with toner. So I'm going to get some cotton rounds and I'm going to spray them with toner. Remember, you can also spray over your client. Depends on your preference. Making sure that my toner spray does not come into contact with my cotton rounds. And she just had the extraction part, which sometimes is not fun. Now she gets to have the massage part. So after your toner, you get to go in to do your client's massage, which is probably their favorite part of the entire facial. So make sure you have enough of your massage product before you go in there to apply everywhere, so that you don't have to go back and find or get out any more of your massage product. Just spread it out really good before you start your massage part. we finished our massage, we are going to remove the massage product. My poor girl had it in her ears. It's because my hairnet won't stay on. Our headband won't stay on. Okay, once your massage product has been removed, you can go to the mask step and apply your mask. So I'm going to get my fan brush for this. Let me put her hairnet back on. And I am going to apply my mask. I'm going to try to do nice, long, thin strokes. Neck and up. Of course, I'm going to read and follow manufacturer's directions. I'm going to avoid the eyes, the nose, and the mouth with my mask. Yes, it looks really nice. And so with your masks, what you want to do is allow the mask, depending again on the manufacturer's instructions, etc., allow it to sit on the face for 5 to 10 minutes, which we are not going to do because we're making a video. So we've applied it. I use the fan brush. There's other ways to do it. And so we need to remove it. We're pretending like it's been on for 5 to 10 minutes. And we have removed all of our mask product. And now we need to tone. Skin looks great. And once you're finished with your toning, you are going to apply appropriate skincare. And it's still daytime, so we're going to be using eye cream and moisturizer with an SPF. So you're going to need a teeny bit of eye cream, and you're going to be applying it to your ring fingers because they're the most delicate finger, and you're going to apply it with a little light tapping motion. And you're going to apply it to the zygomatic arch and the brow bone. So you just want to rub those ring fingers together, and you're going to go tap around. I don't know if anybody else has this problem, but my fingers are totally wrinkly from all the hand washing and all the washing in the facials videos. And then we are going to apply her moisturizer, her daytime moisturizer, and I've chosen a hydrating one with sunscreen. And I'm going to apply it, you don't need a lot, but I'm going to apply it where she needs it if she's going to be exposed to the sun. So where I'm going to add it is her, of course, her décolleté and her neck, chin, the whole face, everywhere. And I even, if her hair's going to be out, I might even put some on the ears, but definitely the face, the neck, the chin, the décolleté, anywhere you think that when she leaves there might be some sun exposure. Always really good to explain the importance of sunscreen and why you want to use it always, even on a cloudy day. And just get it all blended in. For your client who's probably asleep because they have just had such a nice facial. And then you just finish your facial, close it out. And then at this point, you're going to let the client have some privacy to get dressed again, etc. Remove all the extra towels and things, and then she's going to put her clothes on, and then she will meet you so that you can do your after-service follow-up and maintenance and aftercare conversation. You'll get her checked out with the products that she needs for home, and book her next appointment, and then you're going to come back because you got to get ready for your room for your next client. So you're going to discard any of those single-use items, trash them. You're going to place implements that you might have used in a closed container labeled to be disinfected. You'll place cape, used towels, all of that, sheets, in a closed container until it's time for laundry. And then you want to clean and disinfect your work area. So you're going to properly identify a cleaning agent, read manufacturer's directions, and follow directions for mixing and usage. Wipe down your workstation and area with cleaning solution to remove debris. Identify disinfectant that is bactericidal, virucidal, and fungicidal, EPA approved for use in a salon setting. You're going to follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You will disinfect electrical equipment, store it in a clean area separate from other implements. You're going to wash your hands to finish, so we're going to review that. You're going to wet your hands underneath the water, find the liquid hand soap, and you're going to wash your palms together down to your wrists. You are going to wash the back of your hands down to your wrist. You're going to wash your fingers. You're going to wash the backs of your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your fingertips and nails. You're going to wash your thumbs. You're going to wash your wrists. And you're going to do all of that for a minimum of 20 to 30 seconds. When you're finished with that, you're going to find a disposable paper towel. Turn off the water, dry your hands thoroughly, discard the disposable paper towels, find your hand sanitizer that has 70% ethyl alcohol, and you're going to rub it all together, get everything nice and dry, and then you'll be ready to set up for your next service, or if you're done for the day, go home. So this concludes your basic facial application video.